Hi, for this video, we are going to talk about the infection control that should be done prior to oral surgery. Okay, transmission of infectious agents among patients and dental healthcare personnel in dental settings is rare. However, on 2003 to 2015, transmission in dental settings, including patient-to-patient transmissions, have been documented. And that is why all dental settings, regardless of the level of care provided, from a simple dental checkup to a dental cleaning to major ones such as oral surgery, infection prevention must be made a priority and should be equipped to observe the standard precautions and other infection prevention recommendations. Now, a cross-infection is the transfer of harmful microorganisms, usually bacteria and viruses. And these microorganisms can be transmitted by the unsterilized medical equipment through coughing or sneezing, human contact, touching contaminated objects, dirty bedding, prolonged use of catheters, tubes, or intravenous lines. And the transmission of infections can occur also by direct contact with the patient or indirectly through contact with contaminated instruments or surfaces. And the key elements of universal infection control, we have 10 here. First is the medical history. Second, cleaning instruments. Third, sterilizing of instruments. Fourth, the use of disposables. Fifth one is the decontamination of the operatory surfaces. Sixth is the wearing of protective workwear, avoiding needle stick injuries, immunizing staff, safe waste disposal, and lastly, the effective training of staff. And let's talk first about the medical history. Now, medical history is the collection of an accurate medical history, and this is a part of a good clinical practice and is helpful in the identification of immunocompromised patients. Now, through collecting the medical history of your patient, you are going to have the knowledge of the patient's past or the present medical conditions that he or she is suffering to. And the second one is the cleaning of instruments. The cleaning of instruments, of the used surgical instruments, to remove visible deposits is an essential step prior to their sterilization. Instrument cleaning may be achieved by hand scrubbing and soap or detergent, but also we have to be very careful of our skin. That is why we need to wear heavy duty protective gloves to protect us from needle injuries, from poking ourselves with contaminated needles. That is why we should wear heavy duty protective gloves and not just the regular gloves. Okay, for the third one, we have the sterilizing instruments. Now, the cleaning instruments, you are going to remove the visible dirts, but in sterilizing instruments, you are going to remove or to destroy all the microorganisms on the surface of an article or in a fluid to prevent disease transmission associated with the use of the item. And after clinical use, all surgical instruments must be sterilized before they are used to treat a subsequent patient. The sterilization method of use for heat-stable instruments is the autoclave. Okay, so for the fourth one, we have here the use of the disposables. Disposable items are generally recommended, although there is a cost implication. But disposable items must always be used once only and then discarded. Now, why is the use of disposables recommended in a dental healthcare setting? Because when an item is used only once, it cannot transmit infectious agents to subsequent patients. You don't need to wash it, you just need to put it in the trash bin directly to prevent any contamination, any cross infection with that material. Okay, so the fifth one is the decontamination of operatory surfaces. Regular cleaning of surfaces with detergent together with application of disinfectants in appropriate sites are very essential, because there are situations, or really every time, you cannot stop yourself from touching the surface, and that is why you need to clean it thoroughly. In the event of an overt spillage of blood or other body fluid, it should be soaked into an absorbent cloth and a disinfectant such as hypochlorite applied. Okay, the sixth one is the protective workwear. All staff should wear protective coats on wards to protect their outdoor clothing from contamination. Appropriate theater dress, including operating gown, gloves, and eye protection, must be worn routinely when undertaking surgical procedures. And take note, when you are wearing surgical mask, it should be a well-fitting surgical face mask. For the seventh one, we have avoiding needle stick injuries. Sharps injuries are common among staff performing surgical procedures and may go unreported to occupational health departments, and so are not followed up. The thing that I told you about earlier, when you are washing your instruments and you might suddenly poke yourself with a contaminated surgical needle, and that is why we need to avoid needle stick injuries, because it might contain viruses, or it might be contaminated. And so to protect yourself, avoid needle stick injuries. Okay, for the eighth one, immunizing staff. Vaccination against hepatitis B virus is now a requirement in the UK for all healthcare workers undertaking exposure-prone procedures. This vaccine, which contains hepatitis B surface antigen, provides protection from one of the most important and serious occupational infection of healthcare workers. Now, in the event that you accidentally poke yourself with a surgical needle, well, at least you can say that you're safe at all because you have been immunized. Okay, for the ninth one, the safe waste disposal. Hospitals and clinics have a responsibility to ensure the safe disposal of all contaminated waste generated during surgery. Arrangements must be made with a local authority or private contractor for final collection and disposal. Now, we does not only need to think of ourselves, of protecting ourselves against these viruses and these infections. We also need to think of the people that are going to dispose our garbages. And so, one of the things that you can do is you can provide a container for your needles, for the sharp things, and so you can properly dispose it and not just throw it directly in the trash bin. Or you can also do like recapping of the needle, just so you can protect the people that are going to dispose your garbage. Okay, so for the last one, we have the effective training for staff. Good training of all staff engaged in patient care is an important element of infection control. Good infection control procedures should become an automatic part of clinical practice for all healthcare workers. A written infection control policy must be available in all healthcare facilities and procedures reviewed on a regular basis. Now, the infection control that you are going to apply, say for example the cleaning of your instruments, the sterilizing of your instruments, are not is disregarded if your staff or you yourself is not properly trained of the infection control that must be done in your clinic. And so Training is very important, and I think that is all for the infection control prior to oral surgery. And I hope that you are going to apply it to your dental healthcare setting. Bye.